right, I'd like to welcome Damien.
Good afternoon. When I was originally asked to do this presentation, I toyed with two ideas as far as the case studies. One was Ebola, which is the one that you're going to that I'm going to talk about. The other one was the MERS outbreak in South Korea last year, because we were hosting our World Conference a block away from the hospital where the whole thing was unraveling in June 2015. And it made for an interesting case study as per se, except we haven't followed through as far as an organization in the capacity building elements around the examples and the lessons learned from that case study. But I can tell you, having 1,200 science journalists hovering around a hospital in downtown Seoul was a great eye-opener for a lot of those journalists. Just a quick presentation as far as who we are as an organization. The World Federation of Science Journalists is a non-profit. We're based in 70-odd countries around the world. Our main work is really about capacity building, training journalists at different levels of knowledge, and also training local resources. This is something we believe is as a primary importance, is to develop local competency, i.e. not just bringing European or North American journalists to do the training, but actually have local journalists doing that training with their peers. A lot of training, obviously, in the last couple of years around Ebola and Zika. So I was mentioning, how did we get involved in that Ebola crisis? Well, it was quite early on. Someone mentioned MSF in April. It was in May 2014 that we started getting alarming messages from our network of journalists in the area who wanted to share their concerns with us. They were telling us about the poor communication that was heightening apprehension amongst the public. And also seeding confusion amongst journalists, because obviously in those regions, you've got very few specialized science health journalists. Most newsrooms have, the first guy that's hanging around in the newsroom is going to be told to cover the Ebola crisis. Lack of appropriate campaigns. I mean, I'm not going to go through the whole list, but because we've covered quite a bit of that, the misinformation, and journalists who actually, because we didn't have an effective network in Guinea, Sierra Leone, and Liberia, most of the other journalists from the region that were coming back from there were sending us even worse and alarming messages. So we carried out a survey, an online survey, quite early on in August 2014. We had about 100+ respondents to this survey, and it was really to identify the challenges and better understand them, get a clearer picture of the overall needs and capacities on the ground. The major issues, no surprise, that came out included the lack of resources, basic equipment to do your reporting, solar panels to power your radio station in the middle of the forest. So we launched a crowdfunding exercise to try and buy some equipment for some of these media houses. The capacity building element of obviously of reporters was a major issue. And then the cultural context, addressing the issues of local languages, religion, and local, the awareness messages around Ebola just didn't fit the bill as far as they were concerned. Public service messages were misunderstood. And I would say the major element in all this was also the lack of transparency. As you know, transparency, and we've mentioned it numerous times this morning, invariably leads to rumors and disinformation and misconceptions. And I would add, actually, that lack of transparency is also causing us, because I was talking to a number of journalists we've trained in Sierra Leone and Guinea lately, that lack of transparency is having an effect right now with the clinical trials around the Ebola vaccine. The political carving out of the region between the US, the UK, Canada, France and so on, just doesn't go well down there. And there's a complete lack of misunderstanding as to why that was done, and there's no explanation. There's very little knowledge as to how those clinical trials are being carried out for local journalists. So all this needs to be taken on board. The other major concern that was raised was obviously the lack of knowledge. And when I say the lack of knowledge, as far as journalists in the region, it was the lack of scientific knowledge. And when there's no access to knowledge, it ultimately becomes a barrier to creating that culture of evidence that we've all been talking about. And I'd say the primary access points in the region of as far as information, the media and civil society organizations have various individual and institutional barriers as hurdles to get access to and appraise and communicate that scientific evidence. So these are the three areas, three entry points that when we subsequently started doing our training courses and building toolboxes for journalists in the Global South, these are three areas that we really underlined in the course curriculum. Obviously, accessing the evidence is a major challenge in a number of middle and low-income countries, not just because of technology and lack of proper internet access, but, you know, imagine rigorous systematic reviews, impact evaluations. That's even further removed to these journalists. When they do find rigorous evidence online, it's only abstracts, because the full reviews, you have to pay most of the time for those, and at high cost. Rigorous high-quality research is mainly undertaken by Northern elite institutions as far as they're concerned. So there's a lack, you know, if you're going to try and understand better how things are, the science behind the research, you might want to talk to a local researcher when you're in Angola and not someone who's on the other side of the planet. So all this research is of minimal relevance to a lot of low and middle income countries. The other entry point is obviously the appraisal part of evidence. When you're spending a lot of time trying to find the evidence, you've got even less time to appraise it. So it often competes also with traditional knowledge. So how do you, you know, that playing field is also something that you need to address when you're doing the training of local journalists in the Global South. And I'd say general beat journalists, because that's what we're talking about, non-specialized journalists, often use information that's going to be attractive to their audiences. And finally, by and large, general beat reporters are not interested in becoming experts in science. They're just going to try and read and understand the basics, and they won't make overt attempts to contextualize these studies. Final point is the limited capacity to translate and communicate the evidence. There's institutional barriers. The editors in the media houses, sometimes they're not aware or don't understand. They don't pick up the research stories. So when a journalist is trying to pitch a story, it just doesn't get past that process of the editor. And final point, a lot of research or science or health and so on coverage ends up being published in, you know, the back pages of some of the supplements or newspapers. At least in the examples I'm giving you, again, they're very focused in Africa. So what did we do? Well, we started targeting non-specialized, non-science journalists, obviously, for our training programs, because there's very few specialized journalists. We also, as I mentioned previously, did a lot of training to build the local capacity, training of trainers. We built toolboxes to understand to help them understand some of the science and research, dissect the jargon, the ethical aspects of covering scientific stories. And we've got ongoing research also with a couple of universities, Concordia University in Montreal and Université Bouaké in the Ivory Coast, to map out a typical, we've been doing this for the past year to try and map out a typical communication ecosystem in periods of crisis in Western Africa. Hopefully the results of that research will come out in the next couple of months. The other issue is the sustainability of all this. It's all very good to train people in the periods of crisis, but what do you do to keep them engaged? You know, the idea is also to develop a sustainability program. It's no use training and then leaving them behind to their own devices. So it's really resting also, our programs are now resting more and more on creating a community of stakeholders. We're starting to engage and train, I think we mentioned it earlier, researchers to better communicate. We're engaging with civil society organizations because ultimately they make use of scientific evidence and then communicate it in their own way. We're trying to see if there's a way between the media and CSOs to at least have a common ground in communicating that evidence. And obviously, involving editors is something that we're looking at. So these days, we systematically embed editors in all our training so that they're exposed to health and science coverage. We've also been widening the scope of training and tools as far as we're concerned. I'll try and fly over this. Some of well, obviously, as I mentioned, the capacity building and the sustainability of this is very much about continuing to engage the trained journalists, which is what we've done with all the journalists. We've trained over 100 journalists in the 3 countries that were affected by Ebola. I would say now at least 7 of those are full-time journalists covering only science and health topics, which is a major breakthrough as far as we're concerned. And the idea is to keep those journalists engaged, by giving them further resources. We're building toolboxes on vaccines, on dementia, and not just for those journalists working in that part of the world, but also in the global south in general. And so this is something that we're really proud of, ultimately, is to keep those journalists engaged and also expose them to the wider network of journalists who might be working for the scientific Americas of this world. Final point I wanted to highlight is what I call the Swiss Army knife. We're developing a new tool right now to help connect journalists with experts. As I mentioned, it's a major issue for journalists in the global south and in a lot of middle-income countries. So we're building an app dashboard platform where journalists will be able to sign up on one side, have their full profile on the other side, vice versa. We're going to have research institutes and so on who are going to be, through their communication departments, able to sign up. And they, if you've got a journalist in Angola who wants to talk to a specialist on yellow fever, they will be using that tool to try and connect with a researcher or someone that's worked in that environment, because that's what they're missing right now, is to, I know there's the trust building element with the research community that goes through the training programs that we do, but there's also just the general communication aspect of trying to link up those different communities. Second component is going to be a learning, and I saw someone was doing gamified tools. This is going to be the same approach. We're going to have a gamified e-learning component where sort of 101 for the non-science journalist, whereupon we're going to remind them of all the stages that they should think about when they're covering a science story, or about the ethics related to it, about debunking fake stories and so on. How do you address rumors? So that's going to be a gamified e-learning environment. Other part I mentioned it, the verification toolkit. This is what we're going to work on in the next few months, is to also give them tools and applications that will enable those journalists to quickly at least verify the source of some of the research that they're consulting. All these tools are going to be open access, so it's going to be third-party friendly. The idea is to also work with a wider community of developers to adapt the tool as to different cultural environments and as we move on. One last and data collection, I won't run through all this. One last project that we're building, we're just starting, just to give you a different emphasis. We're building a program with the First Nations in Canada, in isolated and offline and off-the-grid communities. We're going to try and citizen reporters in different communities to be the linchpin between those communities and the public health agencies in those territories. And it's a tool whereupon those citizen reporters are going to be eavesdropping, if I can call it that, to all the conversations amongst those communities about vaccine hesitancy, about childcare, health, and so on. So this is a program, a different dynamic, a different way of investing science journalists and the journalist community, but I think that's something that could be replicated in different areas of the world, these citizen reporters that become the trust element within the communities, and that we don't send a science journalist, and I've got nothing against the BBC science journalist or whatever, but someone from elsewhere engaging with those communities, because the dynamics in those environments are very peculiar and different, and we need to have that trust building element at the forefront. Anyway, I could go on and on, but thank you again.